Hi guys, and welcome back to the channel. This time around I want us to discuss peptic ulcer disease with specific emphasis on the alarm signs and symptoms you should always look out for if you have the condition. But just before we get into all of that, let's try and get a basic understanding of what peptic ulcer disease is and how it really works. So what exactly is peptic ulcer disease? Well, peptic ulcer is ulcer of the stomach or of the duodenum, and in very simple terms, an ulcer is just a sore which develops when there is a breakage or a discontinuation in the lining of an epithelium, in this case of the stomach or of the duodenum. But generally speaking, ulcers can develop anywhere on or in the body. For example, people can have mouth ulcers, genital ulcers, leg ulcers, and several others. The bottom line here is the fact that peptic ulcers are of clinical significance because they can worsen over time and eventually cause perforation of the stomach or of the duodenum, leading to life-threatening complications. There are two types of ulcers depending on their locations. We have gastric ulcer, which is found in the stomach, and there is also duodenal ulcer, which is located in the duodenum and is 2 to 3 times more common than gastric ulcer. Another difference between the two is the fact that in gastric ulcer, you tend to feel the stomach pain more during and shortly after meals, while in duodenal ulcer, the pain is aggravated by hunger and tends to get relieved when you eat something. Now, while I will not be dwelling so much on the causes and risk factors of peptic ulcer disease, just know that most cases of peptic ulcer are caused by two things. Number one is an infection with a very shameless and cowardly bacteria called Helicobacter pylori. The bacteria finds a way to attach itself to the wall of the stomach, releases enzymes which make it very easy for the stomach acid to begin to dissolve the layer or lining of the stomach and eventually cause an ulcer to develop. Luckily, this very shameless bacteria can be effectively eradicated with the use of appropriate antibiotics. The second reason or the second cause is the prolonged and heavy use of NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs like ibuprofen, diclofenac, aspirin, and several others. Of course, they are very effective in the management of mild to moderate pain, but when you use them over a long period of time and in high doses, they can cause an ulcer or they can cause a peptic ulcer to develop. In fact, we have a very fancy name for it called NSAID-induced peptic ulcer. Now, having established the above facts, let's now focus more on the 5 alarm signs and symptoms of peptic ulcer you should never ever ignore. I'll be right back. So here are the 5 alarm signs and symptoms of peptic ulcer disease you should never ever ignore. And by the way, we call them alarm signs because they signal an advanced stage of the disease where life-threatening complications can happen. Number 1, early satiety. This is when you get filled up very easily after eating just a tiny portion of food, even when you are very hungry. If you have peptic ulcer disease and you start noticing that you are getting filled up very easily after eating small portions of meal, please discuss this with your doctor because it's very important. Why? This is because in a small percentage of cases, peptic ulcer can progress into cancer and form a tumor. The tumor eventually grows and occupies a portion of the stomach, encroaches on the space of the stomach and reduces the capacity of the stomach to hold large quantities of food. This is why you get filled up very easily. Number 2, unexplained weight loss. This is another alarm sign you should never ignore. If you have ulcer and you notice that you are losing weight that is unexplained and unintentional, please discuss this with your doctor. Do not ignore it at all. Number 3, GI or gastrointestinal bleeding. This happens when the ulcer has eaten very deep into the stomach wall and has starts to encroach on blood vessels. Initially, it starts out very slowly. The bleeding starts out very slowly, all right, in trickles, and you may even notice a few blood stains whenever you throw up. Okay, but as the ulcer worsens, the bleeding also gets heavier, and God forbid, if the ulcer perforates, the bleeding can become very torrential to the point whereby you start vomiting serious blood, or it could be a case whereby you are defecating blood which may come out as fresh blood, or if the blood has undergone some digestion has been acted upon by enzymes and chemicals, it can mix up with your stool and give it a very black appearance. We call it melinal stool. And last but not the least, anemia. Anemia simply means shortage of blood or blood shortage and is indicative of a bleeding ulcer. Of course, if the ulcer is bleeding internally, over time the blood loss can lead to anemia with symptoms like dizziness, with symptoms like shortness of breath. You can feel very fast heartbeat that is irregular, you can feel tired, and several other symptoms. So there you have it, guys, the 5 alarm signs and symptoms of peptic ulcer disease you should never ignore. Always be on the lookout for these symptoms if you have ulcer, and should you notice any one of these, please don't hesitate to seek prompt medical attention. Very important. That will be all for today, guys. Thank you so much for watching. Please, if you got some value from this video, go ahead and drop a comment, like the video, and please support me to grow by subscribing to my YouTube channel. And don't forget to turn on the post notification so that you get notified whenever I make a new post. Bye bye.